So let's put everything that we've learned together and come up with a homeostasis loop for regulating mean arterial pressure. So here we have our controlled variable, which is going to be MAP. And let's pretend we're having a big drop in MAP. So you fell asleep on the Lee Street railroad tracks, got your arm cut off, and you lost a lot of blood and your blood pressure is dropping. So big emergency situation. Well, this will be detected by sensors as part of our homeostasis loop, and the sensors that monitor blood pressure are called baroreceptors. And we know that we have baroreceptors in a couple of places. We have them in our kidney, and we also have them in our aortic arch and carotid artery, so that we have sensors close to our heart-brain loop, because as we know, it's really important to maintain adequate blood delivery to our heart and our brain, which are tissues that can't afford to be without any oxygen for any length of time because they can't replace themselves. So these afferent neurons are going to report to an integrating center. So these are what we had originally called error signals when we first did a homeostasis loop. They're afferent neurons bringing information into the sensory nervous system. So within the central nervous system then, or CNS, we've got a couple of places where information from baroreceptors is integrated. One is the hypothalamic posterior pituitary axis, and the other is the cardiovascular control center, which is in the medulla oblongata. So CVCC equals cardiovascular control center, and that's in the medulla oblongata, which is part of the brain stem. Okay, so we've integrated that information, and then we're going to have some efferent output to send messages to our effector tissues, which are going to act on cells that are cells and tissues that will bring our MAP back up again. So before we put in our signals, let's put what our effector tissues are. So we have vascular, circular, smooth muscle of our blood vessels. And we have the SA node of the heart. So we have autorhythmic cells. We have our myocardial pumping cells. And the other tissue we haven't really talked a lot about this yet, but we will, is the kidney. Okay, so let's start with the output from the hypothalamic posterior pituitary axis. So when low MAP is detected, or we could have high plasma osmolarity, then the hypothalamic posterior pituitary increases secretion of ADH, or vasopressin. So do you guys recall where you have ADH listed in your notes? And you're probably thinking it's in your list of vasoconstrictors, and it is. So ADH has receptors on vascular, circular, smooth muscle, and it causes, when it binds with receptors, we get increased peripheral vasoconstriction. So we're going to be squeezing blood into that heart heart-brain loop. There's also receptors in the kidney for ADH, and we'll talk about that in a lot more detail later, but we have increased water conservation is the activity of the kidney. Can't add it back to the blood, but we can conserve what we have. Okay, so now let's look at what is the response of the cardiovascular control center to signals from afferent neurons that blood pressure is low. After that's integrated, we'll do this in another color, we have increased sympathetic output. So you guys will recall we've got norepinephrine from sympathetic neurons and epinephrine from the adrenal medulla. So where do we have receptors for epinephrine and norepinephrine? And that would be adrenergic receptors. Well, we know that we have adrenergic receptors on blood vessels. So we're going to have vasoconstriction at alpha adrenergic receptors, and we know that we've got receptors on the SA node of the heart, so that when epinephrine or norepinephrine binds there, we get an increase in heart rate. And we know we have receptors for epinephrine and norepinephrine on the pumping cells, so we'll get an increase in stroke volume. And the sympathetic output also influences water conservation by the kidney because it reduces blood flow to the kidney through alpha adrenergic receptors. So we can implicate the sympathetic nervous system in water conservation as well. Okay, what about these kidneys acting as baroreceptors? If you recall, when the kidneys detect low renal blood pressure, we have increased secretion of renin, or renin, you want to call it that. And remember, that converts that precursor protein that's always circulating in your blood called angiotensinogen. So it's always there, just circulating around, not doing anything until the kidney detects low pressure, secretes renin, converts it to angiotensin 1. Angiotensin 1 doesn't do anything, at least as far as I know, and it is converted by ACE, angiotensin converting enzyme, to angiotensin 2. This is an active hormone, and it's not a steroid hormone. It's a non-steroid. So if you guys recall, angiotensin 2 is on your list of vasoconstrictors, so it also causes increased peripheral vasoconstriction. It also has receptors in the hypothalamus, where it also causes increased ADH release and also increased thirst, because that would be a great way to restore homeostasis if you've lost some fluid, is to drink and get fluid back. The third place that we're going to talk about receptors for angiotensin 2 is in the adrenal cortex, which I guess is going to go over here. So we'll put the adrenal cortex. And when angiotensin 2 binds with its receptors in the adrenal cortex, this causes increased synthesis and release of aldosterone, which is a steroid. And aldosterone has receptors in the kidney where it also promotes water conservation. The response of the kidney to low MAP is a slower response compared to the peripheral vasoconstriction and increase in heart rate and stroke volume. Collectively, these are referred to as the Baroreceptor Reflex, and these changes happen almost immediately. It takes a little bit of time for the effects of the kidney to be realized. So the end result of all of this, of all of these effectors, and let me do that back in another color, is to bring MAP back up. Now, if you've lost a lot of fluid, it might not bring it back up to the original, your normal blood pressure, but it'll certainly bring it back up from where it was here when you initially had that emergency situation, maybe due to blood loss, I think was our scenario here. What you guys should do is take your notes template of this blank and make sure that you can reproduce this for yourself without looking at your notes. And also make sure you can do it for the reverse situation. What if MAP went up? Can you fill out this homeostasis loop for increased MAP? That would be a great way to prepare for your next quiz.